Good evening and thanks for joining us. Even if you aren't sick with the virus and don't know anyone who is, COVID-19 is beginning to disrupt lives around the world, well beyond the epicenter in China. From flight cancellations and travel restrictions to warnings of serious economic implications, millions of people are feeling the effects of what's become an international health crisis. There are now confirmed cases in at least 50 countries. In France, where there are 38 known cases, the president told doctors today an epidemic is coming and to prepare for it. The biggest outbreaks outside Asia are still in Italy and Iran, but almost every hour another country confirms new cases. The potential impact has spooked investors so much the investment bank Goldman Sachs forecasts American companies will see zero earnings growth in 2020. In New York, the Dow Jones plummeted almost 1,200 points. That's the biggest one-day point decline in history. In Toronto, there were huge sell-offs, too. On the TSX, it dropped more than 300 points before trading was abruptly halted for the day. The exchange blamed technical issues. Here's what's also fueling fears. Thousands of people in California are being monitored for signs of COVID-19. They may have come into contact with a woman who tested positive there, and she was sick for a week before she was tested. How she got the virus is a mystery. Officially, there are 60 confirmed cases in the U.S., but it's clear now not everyone who should be tested is being tested. Jackson Proskow on the trouble that is causing.
In Northern California, a new COVID-19 mystery. A woman with no history of travel and no contact with known patients has tested positive for the virus. She's in hospital and on a ventilator.
The person who exposed them probably exposed others, so there's probably other cases out there in the community that we don't know about.
It may be the first case of community transmission in the U.S., exposing a huge gap in the American response. Despite being in hospital and having all the symptoms, the woman wasn't originally tested for COVID-19 because she didn't meet strict U.S. government criteria. The exact scenario experts have warned about.
I'm very concerned about the level of testing, and I'm puzzled about the level of testing. If a country like South Korea can do tens of thousands of tests, I do not understand why in our country we have managed to do barely 500.
More than 8,000 people in California are now being monitored for symptoms as the U.S. scrambles to ramp up its testing ability. But in Washington, the response to the virus has been defiant.
I don't think it's inevitable.
On Wednesday, the president contradicted his own experts and proclaimed the U.S. would soon have almost no cases of the virus.
We're going to be pretty soon at only 5 people, and we could be at just 1 or 2 people over the next short period of time.
Wall Street isn't buying it. The Dow took another steep dive, continuing its rapid decline into correction territory. While the White House reportedly considered enacting special wartime measures to increase production of masks and protective equipment for medical workers, officials have warned supplies are woefully inadequate. There's also a heavy focus on managing public perception. U.S. government scientists and officials have been told they can't speak publicly or to the press until they coordinate with the Office of the Vice President, the man overseeing Trump's coronavirus response. Dawna?
All right, Jackson Proskow in Washington, thanks. Right now, the most deaths outside China are in Iran. A major religious gathering there has been canceled. Friday prayers have been called off in Tehran and several other cities as well to try to limit the spread. After a dramatic jump in confirmed cases, the official number in Iran is 245 and 26 deaths. And it's spreading through senior Iranian officials after Iran's deputy health minister, who kept working while visibly sick and then tested positive. At least 5 others are now ill, including a female vice president and a prominent cleric who has died. Crystal Goomansingh has details on the global spread of this virus.
The crowds have vanished. The novel coronavirus is scaring away customers from the cafes and shops of Italy. Venice is on its knees, says this business owner. We don't know how to react. More than 600 people in Italy are infected, and COVID-19 has caused 3 more deaths in the Lombardy region. The governor there is infected and is updating people on his condition by posting videos online.
The epidemics in the Islamic Republic of Iran, Italy, and the Republic of Korea demonstrate what this virus is capable of. But this virus is not influenza. With the right measures, it can be contained.
But it's not being contained. South Korea, with the largest one-day infection spike since January 20th, set up drive-through screening centers. Nearly 9,000 kilometers away, another mobile site, this one in London, where again, more cases have been detected. Australia's Prime Minister outlined his country's plan to protect public health, and he didn't shy away from the seriousness of the virus.
WHO is yet to declare the nature of the coronavirus and its move towards a pandemic phase. We believe that the risk of a global pandemic is very much upon us.
Mitigating risks is a key, and for the first time, Saudi Arabia is banning all foreign pilgrims. Officials say we feel a sense of responsibility, therefore we took these temporary decisions which will constantly be reviewed. A full ban wasn't even implemented for the Ebola outbreak in 2014. Throughout the year, millions of Muslims head to the kingdom for pilgrimages, and there's no time frame for when this ban might be lifted. Crystal Goomansingh, Global News, London.
Here in Canada, there are no deaths linked to COVID-19, but there are 13 confirmed cases and now a new presumed case in Montreal, a woman who is self-isolating and recently returned from Iran. Officials are waiting for test results to confirm it. In Ontario, the newest case is a man in his 60s who picked up the virus from his wife. She tested positive after returning from Iran. That couple is now at home in self-isolation. Federal officials say the risk of contracting the virus in Canada remains low.